Hello, and good morning, good afternoon, or good evening, wherever you are. My name is Deontay Marquis. I'm a registered nurse and family nurse practitioner in Southern California. And today we will be discussing Parkinson's disease, how to assist residents to live beyond the limits of Parkinson's disease, which unfortunately, for those who suffer from Parkinson's disease, this specific disease impacts every single aspect of their lives. So we're going to help them to live beyond the limits set by Parkinson's disease. And we're going to go over specifically how you can assist your residents in doing so. And this presentation is brought to you by myalftraining.com. So without much further ado, let's begin our presentation today. Okay, so first I like to start the presentation by going over the main course objectives for today. And those course objectives are, as you can see here, number one, to define Parkinson's disease and be able to discuss the physical and emotional effects PD, Parkinson's disease, may have on a person. Next, by the end of this presentation, you will be able to recognize and identify common symptoms associated with Parkinson's disease onset. So this way, when you're taking care of residents who may be showing symptoms which you believe are Parkinson's disease, or you're not sure quite what's going on, you'll have some idea into what to look for, what to report to the doctor, and then also how to note when a resident with Parkinson's disease is getting worse or their disease is worsening, entering into the later stages. Third, one of the main points of this presentation, you will be able to discuss care considerations for individuals who suffer from Parkinson's disease. That is what this presentation is all about, is helping us assist the residents to live beyond the limits of Parkinson's disease. And last but not least, you will be able to recognize and discuss emergency safety concerns for residents suffering from Parkinson's disease. So specifically, how to prevent these emergencies from happening, so you will be more perceptive to them before they happen and how to prevent them. So as we discuss our first slide, well, what is PD? What exactly is Parkinson's disease? How does it come to affect so many Americans, people around the world? And what is going on with the body when they're suffering from Parkinson's disease? Well, PD is a neurodegenerative disorder that affects a specific part of the brain that emits dopamine. Now, what is dopamine? Dopamine is a chemical or a neurotransmitter that's released inside the brain, and it's usually released in response to feelings of pleasure or satisfaction. It's a part of the reward system. It's what drives us to do good and what makes us feel sad as well, a lack of dopamine. So what does dopamine do? Essentially, it boosts mood, it boosts motivation and attention. That's why if you ever heard someone talk about, oh, if you go to the gym in the morning for a consistent amount of time, maybe a week or two, you'll start to have this dopamine release, this feel good motivation will kick in for you to go. And that's also kind of the same idea if you've ever heard of something called a runner's high. Once the runners are running, they feel good, their dopamine is being released, the pain from their legs hitting the pavement isn't as painful, and all of a sudden they love running. So that's why people who really love to run love running, because that dopamine release, that feel-good chemical, when they're doing something that benefits them. So the cause of this lapse or neurodegenerative disorder is unknown. So we don't know what exactly causes the dopamine to stop being produced, or for the part of the brain that releases and creates dopamine to stop. But we also know there is no cure. But there are several different types of treatments and medications that are available to manage the side effects caused by a lack of dopamine. So, what are the symptoms of someone who is suffering from Parkinson's disease? Well, on the last slide, we talked about what Parkinson's disease is, and it's essentially when there is no more dopamine or not enough being released from the brain to the rest of the body. So if we know that dopamine is responsible for things like runner's high, makes us feel good, it can even give us motivation, then we can expect that a lapse of that would cause us to have things like depression, sleep disorders, fatigue, okay? Even a loss of smell or hallucinations and delusions. All of these symptoms are tied into one another. Because if we're anxious and depressed, then we're sleeping a lot, and then maybe we're awake at nighttime because we're slept all day, or maybe you're sleep deprived, you're not able to fall asleep. So sometimes you're feeling fatigued a lot, you're anxious because you don't have that feel-good chemical, you're not sure what's going on. And then of course, with all this going on in your mind, sometimes we hallucinate or we have delusions. We think things are real that aren't necessarily real. We see things that are there that aren't necessarily there. So unfortunately, those are some of the symptoms. So be mindful that in the elderly population, these symptoms are also very psychological. So we may think that a patient is suffering from some type of psychological disorder when really it may be Parkinson's disease. So one of the main symptoms, however, of Parkinson's disease is movement, because Parkinson's disease is a movement disorder. It's responsible for tremors, slowing and stiffening movements, okay? Parkinson's disease affects many systems in the body. However, one of the most affected, of course, is the brain and the ability to move. But the symptoms associated with Parkinson's disease are very different from person to person and develop very slowly over time. So it's very slow, very gradual, okay? Now, you may be wondering, well, if there are so many different symptoms and so many different ways that Parkinson's disease can affect an individual, how do we know for sure someone has Parkinson's disease as opposed to any other type of ailment or disease? Well, that is because there are three main symptoms that are present in order for an individual to be diagnosed with Parkinson's disease. And you'll see I have those symptoms here in red. So that would be tremors. That is very characteristic of Parkinson's disease. Slowed movements, such as bradykinesia, and stiffness. These are all symptoms associated with Parkinson's disease, okay? So in order for Parkinson's disease to be diagnosed, those three symptoms are usually present. And I have those in red there, so please make sure you remember those. Now, moving right along, additional symptoms. So we talked about dopamine. Dopamine is the largely the most responsible culprit here in the cause of Parkinson's disease. And again, we're talking about dopamine here. So I included this picture here so you can see what a normal neuron looks like. Now, a neuron is a very small aspect inside the brain, a very small structure. And this is dopamine here, these green dots. They're leaving the neuron and being transferred through what they call a synapse, the space between the neuron and the rest of the body's cells. And then they're allowing normal movement, normal feeling. They're allowing us to be normal. But in an individual with Parkinson's disease, their neuron, it looks similar, but you can see there is a significantly less amount of dopamine being released. And all of the receptors are not being filled. Whereas here, all of the receptors are more than filled. But here, not quite. And that causes movement disorders. Muhammad Ali, one of the most infamous and almost a figurehead for Parkinson's disease. If you've seen him on television in his older years, or news interviews, or just anywhere, if you've seen him, you've noticed his inability to move. Once a very swift, fast-moving boxer, and now he's almost unable to move quite like he used to. And the tremors, the constant tremors, that's because it's a movement disorder. So dopamine is a chemical messenger or neurotransmitter responsible for controlling movement, emotional responses, and the ability to feel pleasure and pain. Now, that does not mean an individual with Parkinson's disease cannot feel pleasure and pain. That just means their ability to do so is altered. In people with Parkinson's, the cells that make dopamine are impaired. As Parkinson's progresses, more dopamine-producing brain cells die, and your brain eventually reaches a point where it stops producing dopamine altogether, okay? Now, we're gonna watch a short video just to give you guys a clear view of fall prevention and precautions for individuals with Parkinson's disease. Now, why is that important? Well, we've talked about how Parkinson's disease affects us psychologically, emotionally, but one of the key characteristics leading to a diagnosis and one of the standout side effects of Parkinson's disease is its effect on our ability to move normally, and it causes tremors, right? So if someone is unable to move normally, they're within the elderly population, then that means that they are an increased fall risk. So that is one of the most important things we want to note for. So this video is from the Parkinson's Foundation. Let's take a quick look and see what they have to say.
As Parkinson's disease advances, movement becomes increasingly difficult. Slowness and muscle stiffness make it harder for the person with Parkinson's to rise from a chair or walk safely. Balance skills are often affected, adding to the risk of falls. You will likely need to provide more hands-on assistance and learn safe, effective ways to provide help without injuring yourself or your loved one. Talk to the person's provider about a referral to a physical therapist. These professionals are trained to conduct an evaluation and help you develop the best methods for your situation. Make sure that the person with Parkinson's uses a chair with sturdy armrests and a stable sitting base. Rocking or swivel chairs will make rising even more difficult. If using a wheelchair, remember to lock the brakes so the chair is stable and does not move as the person attempts to get up or down.
This is important to remember even if an individual with Parkinson's disease, they aren't in the later stages and they are able to wheel themselves around. I want to encourage you to, I want you to encourage them to move as much as they can, but at the same time, we want to make sure when that person is not moving around that we educate them, and we also check on them to make sure that their wheelchair is indeed locked, because we don't want their tremors for them to fall out of the chair.
Avoid soft, low seating or upholstery such as velour or velvet, which can make movements more difficult to perform. Raising the seat height by adding an extra cushion to the chair or using a sturdy folded blanket or pillow often works well. Changes in the brain can also make it difficult for the person with Parkinson's to determine proper body alignment when moving to sit down in a chair. This can result in the person attempting to sit down before his body is close enough or in proper position to sit safely. Marking the floor with a taped X provides the proper cue as to where the person's foot needs to be before sitting. You may also
So marking the X for sitting, and where does someone sit often or other than in the sofa, in the bathroom, on the toilet. So using this tactic is also beneficial for your patient's safety in the bathroom, in the day room, in front of the chairs or the couch, so that they know, okay, my feet need to go here before I can bend down. And it's just an easy, mindful thing to help them Stay safe.
Remind the person to wait until they feel the chair against the backs of both legs before attempting to sit down. Placing hands on the armrests and leaning forward as he attempts to sit down helps maintain smooth, controlled motion and avoids crash landings, which can be dangerous and hard on the person's spine. Make sure your loved one scoots their hips forward to the edge of the chair before attempting to get up. Leaning back into the chair often helps move hips forward more easily. Next, have the person sit up and grasp the armrests, leaning forward with feet firmly planted underneath him. Caregivers may need to assist the person with proper foot placement. Using a cue like nose over toes often gives the person a goal for leaning forward, making the transfer easier to perform. Counting slowly or another prearranged signal to begin, make sure you are working together. When providing assistance, avoid pulling on the person's arms or legs as they try to stand, as this increases injury risk both to the person with Parkinson's.
This is important because sometimes, definitely in my experience, when you try to assist patients or patients ask you for assistance, the first thing they do is what? They reach out their hand. They want you to hold their hand and pull them up. But that places you at a very high risk for injury. And also, sometimes the patients have more brittle bones or restricted movement, especially our Parkinson patients, because they become stiff and rigid from the inability to move as freely and also just the nature of the disease. So we want to make sure that we're remembering not to grab the patient's hand and not to pull on their wrist or under their arm when we're helping them to a standing position.
And the care partner. Use of a transfer belt often makes providing assistance safer and easier to perform. These belts can be purchased at a medical equipment store and are placed snugly around the person's waist to provide the caregiver a better, more effective grip. If your loved one is no longer able to provide assistance getting up and down with hands on armrests, it may be best to stand directly in front of her, grasping the transfer belt with both hands. Using a prearranged count or signal, assist the person to their feet. Then slowly perform a pivot turn in the direction of the wheelchair or other surface she is moving to. If turning is too difficult, consider the use of a pivot disc, which can eliminate the need for the person to move her feet during the transfer. If the person with Parkinson's is no longer able to bear weight through their legs, a mechanical lift to aid transfers may be needed. Before trying it, you should arrange for an assessment to make sure this option would be safe and effective in your case. A physical or occupational therapist know how to help the person with Parkinson's move around so that both you and your loved ones.
So I skipped over the part where she was talking about a mechanical lift because not all facilities have the option or to choose a mechanical lift. And then we did briefly scrub over, she said, to reach out to an occupational therapist or physical therapist to routinely intervene and assist with the patient's care. And this is because we want to make sure that even though they're not able to move as freely as they want, we're still making sure that we do everything we can to reduce muscle stiffness and tightening up and muscle wasting from them not moving as much.
Stay safe. Watch part 2 of Movement and Falls for important tips.
So we will definitely watch part 2. But for now, let's get back to our presentation. Okay, so we learned from our video on movement that it is important to make sure that we take extra precautions to keep the patient safe from themselves. Parkinson's disease, as we said, is a slow progressing disease. So the patient won't wake up one day and completely lose their strength, but it will slowly decline, which makes it more likely for the patient to not be as perceptive of their own strength because it's slowly fading away. So We want to make sure that we are doing everything we can. We're putting the X's, the small reminders in front of the sofa, the chairs, the bathroom, that we're using proper body mechanics when we are helping the patient to a standing position. We're locking the wheelchair whenever, whenever the patient is sitting in the wheelchair and not using it. And we're keeping ourselves safe and the patient as well. And also, if there is a physical therapist or occupational therapist available at your facility, we want to make sure that they are consulted on the case to help assist with the patient as needed. As Parkinson's disease advances, movement becomes increasingly difficult. You will likely need to provide greater hands-on assistance with the patients who have been affected by Parkinson's disease. It's also important for you to familiarize yourself with more safe and effective ways to help moving the patient without injuring yourself or the patient. And again, I relisted here in red the symptoms that we are looking for that patients suffer from with Parkinson's disease. Number one would be tremors, slowed movements, and stiffness, okay? But also, please note, trouble with balance, dizziness, and or fainting. So these patients are at a very high risk for falls. So we want to make sure that we're giving them our extra attention and extra prevention methods to make sure that they don't fall on our watch, right? Next, dressing the patient. It is very important because dressing is a daily task. Parkinson's disease makes dressing harder every single day for the patient, almost so where sometimes they may not even want to participate. Getting dressed becomes a tedious event. It takes more time because the patient's moving slower. It's more challenging for them. And you, as the care provider, will need more assistance than you may think you do to assist this patient. Getting dressed can bring with it a sense of dependence. And it is important that we help our elderly patients maintain a sense of independence for as long as we can. So please try to involve your patient as much as possible. Now you may be saying, well, if they're an increased fall risk, they are prone to passing out and fainting and they're weak and they're moving very slow. How can I involve them and still go through my day with helping my other patients and making sure this patient stays safe? How can I do it? It doesn't have to be big decisions or involving the patient. Small things matter too. So for example, offering them a choice. You have their clothes, you want the red sweater or the blue sweater, and encourage them to make a decision. Laugh with them, joke with them, compliment them. And also you want to encourage them to participate in physical movement. Sometimes they may just sit there, they're tired, they're sad or depressed, and they may not want to move. They may just wait for you to do everything, but encourage them to make physical movement, even if it's small, even if it's just raising their arm or pulling their shirt through, pulling their arm through their shirt after you've already put the shirt over their head. Little things like that can really make a difference, and we want to encourage them to participate at any means we can. Also, you want to make sure that you have adequate time for them dressing, because you don't want to be rushed yourself and you won't want someone to rush you. So please don't rush the patients. They are suffering from psychological and emotional as well as the physical effects of Parkinson's disease. So adding stress really affects their emotional and psychological aspects, emotional and psychological health, which also weighs on their ability to move. So if you're rushing them because they're moving slow and you're getting agitated, you're getting aggravated, you're running out of time, you have a busy day. I understand, I'm a caregiver as well. But please do not transfer that stress or that negative energy to the patient. We want to make sure that before we go into their room to dress them, that we've done other time-sensitive tasks so that we're not rushing them and checking our watch and not pressed for time while we're helping them, and we can really take things slow. Next, you want to consider waiting for the best time to dress the patient. Now, when is the best time to dress the patient? Most of you probably say in the morning or after a bath. But when you're taking care of a patient with Parkinson's disease, that's not correct. The best time to help a patient get dressed is after they've taken their medications and they started to take effect. So if they took their medications 2 minutes ago and walked into the room, it's unlikely that they're already taking effect. You want to wait at least 20 to 30 minutes so the medications start to have some effect on the patient. They'll feel better, they'll be able to move a little bit more, and the symptoms of PD will be a little bit more controlled so you guys can have the best interaction while you get dressed. And if that just so happens to be first thing in the morning after breakfast, then they're starting off the day on the right foot. What else can you do? You can assemble all the clothing items before beginning to dress. Now, this is a caregiver tactic. You always want to make sure everything you think you might need and then some is already in the room before you go to perform an action. Otherwise, you'll be in and out of the room. You'll be wasting time. You may forget something. It gets to be much more of a task than it needs to be. So make sure that all of the patient's clothes are in the room, they're clean, they're ready. You have the options for the patient. So when you go in the room to dress them, everything's there. Next, again, reinforce. You want to encourage arm and leg movements during dressing to keep the muscles flexible. So I said that we want to encourage them to participate with physical movement. This is a little bit more specific. It's called passive range of motion, PROM. So it's just as you're putting their arm in through the shirt sleeve, move their arm around, flex it at the joints because you don't want things to tighten up. So most important for me would be the legs. The legs are one of the largest limbs on most people's body. It has some of the largest muscle mass. So we want to make sure that we're bending the knees, giving them some movement, keeping things flexible, making sure muscle stiffness isn't setting in too tight. Now, if you do notice that one arm or one leg is a little bit more stiff than the other, you want to put that extremity into the sleeve or pant leg first. Now, I know that can be a little confusing, so allow me to elaborate. If you're helping a patient get dressed and you notice that their left arm is a little bit more stiff than their right arm, then you want to put that left arm, which is more stiff, into their shirt sleeve first. Then put the shirt over their head, then encourage them to move their right arm, which is not as stiff, into the other sleeve of the shirt. This will make things easier for you, and this will make things easier for your patient. All right, next, mealtime and swallowing. Why are we talking about mealtime and swallowing? Patients with Parkinson's disease have trouble with movement. Well, let's see why. Advanced Parkinson's disease can make everyday tasks such as eating a meal more difficult. Special care and considerations should be followed to ensure the patient is safe from choking, and also to encourage them to eat and maintain a healthy, calorie-dense diet. Okay, so what can we do to make sure that this everyday task, eating, because if you think about a patient with Parkinson's disease, one of the main symptoms that we talked about is it's a movement disorder. And we talked about the tremors. We talked about Muhammad Ali. If you've seen him recently on TV or in the news, the constant tremors, you can imagine how difficult it would be for someone to sit down and hold a cup of hot coffee and drink it, for them to drink a cup of cold water, or to bring a spoon from their plate to their mouth. That task can be difficult, frustrating for them and for you. So what do we want to do to help them and to help us? One of the biggest things we want to do is we want to reduce distractions during meal time. Okay, so turning the TV off, maybe turning the radio off, or changing the music from something that's upbeat to something slow and relaxed. Also, we want to pick a chair that can comfortably fit the patient as close to the table as possible. This way they can rest their arms, they're a little bit more relaxed, and they are seated up nice and tall, okay? You can use pillows if you need to help with posture because they're not as flexible or stiff as they're more stiff than they used to be. So we may need the help of some pillows to help move them around to a comfortable position, one that looks appropriate and comfortable, and one that they actually say is comfortable for them. What else can we do? We can make sure that the food is different. The food color, I'm sorry, is different from the dish. So we don't want to serve them a green salad in a green dish. We don't want to serve them cauliflower on a white plate. We want to put some contrast between the food that they're eating and also the color of the dish. Now, why is this important? I'm not exactly sure. I haven't assisted a patient with Parkinson's disease with eating a meal, but I think the important thing here is to make sure that the patient is able to focus on what's in front of them, giving them a clear task of what to do, and also making sure that what they're looking at, they're not confusing it for anything else, because we did talk about in one of our previous slides, loss of smell, trouble with balance, hallucinations, and delusions. So maybe the loss of smell, the patient won't be able to recognize that there's food there, they're unable to balance, so this can affect the vision as well. Or maybe they're hallucinating and they're seeing things that aren't there, or they're seeing things that are there that aren't. And most importantly, to keep the patient from choking, small bites, frequent meals. This will make sure the patient isn't taking big bites of food that they're unable to chew and they just swallow and causes them to choke. And also if they're taking small bites, they may not eat a lot because they're not going to sit still for 30 minutes to an hour to finish a big meal. But if we give them small foods that they can enjoy frequently, then we can ensure that they're getting a healthy calorie-dense diet, okay? Now, some important things to note. Parkinson's medications, the most common, are called levodopa and carbidopa. It is important that if the patient is having trouble swallowing or that we don't put these medications in pudding or ice cream because it changes the way that the medications interact inside the body. And that is a big no-no. So draw a big line through this ice cream sundae. Even though it looks great, we cannot put their medication inside pudding or ice cream if they're having trouble swallowing. What would be a good alternative if they are? Applesauce, that's right. I heard someone say applesauce. Applesauce, that's a great idea. If they're having trouble swallowing their medication for whatever reason, or they're not good at taking pills, put the medication in applesauce. Never pudding, never with their ice cream. And a big thing to note, this applies specifically for Parkinson's patients, but it can also be a good rule of thumb for any patients. If they're coughing frequently, and we suspect that they might be choking or they have choked, and we believe it's resolved because they stopped coughing, we want to make sure that we consult with the doctor because it could possibly mean that they have a lung infection. How could they get a lung infection? Easy. The food, wherever they choked on, it went inside the lung. We thought that they were coughed it up or swallowed it and it went through the stomach, but it actually went down into the lung and the food doesn't belong there. So it caused an infection. And last but not least, the Heimlich maneuver. I want you guys after this presentation to refresh yourself on the Heimlich maneuver. You should be able to, be knowledgeable of the Heimlich maneuver when caring for patients of Parkinson's disease population. Next up is mealtime and swallowing continued. So at least 50% of people with Parkinson's develop swallowing problems. The medical term for swallowing problems is dysphagia. Okay, now what constitutes swallowing problems? If the patient has uncontrollable drool, If they're spilling food or liquid from their mouth and they're not talking, it's just spilling out of their mouth while they're trying to chew it. That means that they don't quite have full control over the muscles inside of their mouth, which can be expected for patients with Parkinson's disease because Parkinson's disease is a movement disorder, as well as psychological and emotional. If they're sending food to the back of the throat before it's ready to be swallowed, and we can note this if we're sitting with the patient and they put a big leaf of broccoli in their mouth, and all of a sudden we see them, they're trying to swallow it, and they didn't even try to chew it, and they start coughing, right? So that means that they are probably suffering from some form of dysphagia. This isn't something you want to just look past. This is something you want to alert the doctor, because we want to consult someone to give them a swallow study to see if they should be on a specific type of diet. Maybe their foods should be pureed. Maybe they shouldn't be allowed to eat certain foods. So we want to make sure we're letting the nurse know, we're letting the doctor know, we're bringing this to the attention of someone. If they're drooling frequently, spilling foods from their mouth, and they're trying to swallow things before they've chewed them, we want to bring this to the attention of someone. This is very important because it can cause a lung infection. Caregivers of people with Parkinson's should take care to watch for signs of choking due to increased congestion after eating. And what causes increased congestion? That would be coughing and clearing the lungs frequently. People with Parkinson's also run an increased risk of developing pneumonia because they are at increased risk for lung infections. One of the biggest and worst is pneumonia. So if these patients are suffering from dysphagia, movement issues, they have a loss of smell, they're depressed, they may not want to eat, and we're already offering them frequent meals, small bites, what should we be worrying about? We should be worrying about dehydration, because we're going to be hesitant to give them water if we suspect they may be choking, and also they may not want any water. So staying hydrated is very important for these patients. Now, if they're not drinking water, what are some foods we can give them that are high in water content in place of beverages? Celery, butternut squash, grapefruit, strawberries, watermelon. Those are some foods. So if we see that on the plate come from the kitchen and they're not drinking water and they don't want to eat, we want to make sure we're offering these foods to them, or we're inquiring for these foods for the patient. Which one is your favorite? Watermelon? Okay, let me get you a slice of watermelon. Encouraging them, asking them. Also, small quantities of walnuts, cashews, and other nuts. Why? Because this promotes brain health. Well, if Parkinson's disease is a movement disorder, why are we concerned about brain health? Well, because how does Parkinson's disease begin? What can it be traced back to? Parkinson's disease can be traced back to a lack of dopamine. It's a degenerative brain disease. So anything we can do to promote brain health, to prevent that rapid degeneration of the brain and the cells, which should be producing dopamine, which is the reason why our patient is suffering from Parkinson's disease, we want to offer it to the patient. So nuts and cashews as we can, encourage them. Also, various berries, which contain beneficial antioxidants, which also helps relieve free radicals from the body. And also we want to encourage foods that may have anti-inflammatory effects in the brain, like salmon or salmon, tuna, and dark leafy green vegetables. They have rich anti-inflammatory effects, which can help improve the health in the brain. Now, we have two more videos here, two more short videos. Okay. The first is going to be about using the bathroom. So after the patient has enjoyed all this delicious food, they have to use the bathroom. It's after dinner, it's the end of the day. What should we know when caring for patients with Parkinson's disease to make sure we're keeping them safe? So let's take a look.
A significant number of falls with injury at home occur in the bathroom. Changes in mobility and difficulty managing clothing make bathroom trips challenging. Also, the environment is usually small and filled with hard surfaces like tubs, toilets, and sinks of a similar light color. Vision changes in Parkinson's can make it difficult to distinguish objects. Consider color contrast when installing grab bars and other safety items. For example, put a dark grab bar on a white wall. Also ensure adequate lighting with few darkened or shadowy spaces. An elevated toilet seat can make moving on and off the toilet easier. Some elevated seats have sturdy armrests attached, or a grab bar can be installed on the wall next to the toilet. If you are planning to remodel the bathroom, you can get an elevated toilet installed. Make sure the person with Parkinson's gets close enough to the toilet seat with body properly aligned before trying to sit down. An X marked on the floor can sometimes help foot placement and body alignment and provide a cue to place feet during the transfer. It may also be helpful to have your loved one hold on to a grab bar on the adjacent wall before turning to sit down, or to hold the grab bar when standing up during the process of hygiene and wiping and clothing adjustment. Make sure grab bars are installed properly into the studs of the wall so that towel racks or faucet handles for stability, as they are not.
So she just was talking about the installation of grab bars, how they need to go into the studs in the wall. That's something we don't have to concern ourselves about, but we should note here, she's saying don't grab onto the towel racks if there aren't any grab bars, or if there are the grab bars and the towel racks, make sure that they're grabbing onto the grab bars.
Installed
Because the towel racks aren't fixated to hold that much weight
You may wish
of
to
a
have
person.
moist hygiene wipes available in addition to toilet paper to achieve proper cleaning after toileting. Make sure your loved one is also able.
So we know to wash our hands. We encourage you
Bathing can
using
also
wipes to make
require
sure we're
more
cleaning the
effort.
patient thoroughly.
Usually a walk-in shower with handheld nozzle, grab bar, and tub bench with a backrest work best for safe bathing. If a bathtub is the only available option, consider a tub bench that extends out over the side of the tub for easier transfers.
We're blessed that we have a walk-in shower, and so he's able to just go in and take a shower. Of course, it takes almost an hour longer than usual. So I found out with Parkinson, you can't rush. You gotta like give them at least 2 hours.
Some grab bars clamp securely to the side of a tub if needed. Again, avoid using items like towel rods, shower curtain rods, faucets, or soap dishes for added support, as these items will easily come off from the wall with repeated use. Powders and lotions should be used appropriately to ensure skin is dried thoroughly after bathing. Powders and lotions should be used appropriately to ensure good skin care. If immobility prevents getting into a tub or shower, a bed bath may work to maintain hygiene and cleanliness. Make sure the water is warm and that the person is covered to only expose the portion of the body being washed and dried. Hand sanitizer gels, antimicrobial soaps, and moist towelettes may all be used throughout the day to maintain hygiene. If providing bathing assistance becomes too physically demanding, consider home care options.
Okay, so we learned from there that bathroom and toileting, we should make sure that the patient has a grab bar. If they do have a grab bar, that's great. If they don't, then we may want to use the chair, which sits inside of the tub. And we want to also make sure that, as the lady said in the interview, who cares for her husband, we give them as much time as possible, and that it will take a lot of time. If the patient that we're attempting to bathe is a larger patient or requires more assistance than we can offer them, don't feel compelled to put them into the bathtub or the shower. We can and encourage you to give them a bath in the bed or a bedside bath. Just make sure that all parts of the body which aren't being washed at that moment where you're washing the patient are covered with towels, and that the water is warm. Test the water on the patient first, ask them if that's okay, and then proceed with the bed bath. Make sure that you pat the skin dry, not wipe the skin, and make sure that you, of course, you have your lotions, your baby powders, everything you think you'll need for the shower, for the bed bath to get the patient dressed afterwards is already present, because you don't want to leave the patient. It may be cold, they may be scared, or they may try and get up and walk or do something by themselves and hurt themselves, okay? And here's our part 2 about bathroom care.
Part 1 of this video focused on mobility in the bathroom, but falls are not the only bathroom-related challenge in Parkinson's disease. Bowel and bladder function can also be impacted by Parkinson's. People with Parkinson's often feel a need to use the toilet more frequently and may have episodes of incontinence. Constipation is also frequently seen in Parkinson's disease. All these factors combine to make the daily routine more difficult.
So we drove across the state from Billings to near Helena. And I just remember how difficult it was when he had to go to the bathroom. We had to stop then and get out, and we would be on the shoulder, and I would be holding him, supporting him while he was going to the bathroom, and cars were driving by.
A regular toileting schedule can help decrease accidents during the day. However, incontinence pads should be considered if accidents are frequent. They come in many types and sizes, so read labels and packaging carefully to get the right thing. Make sure skin is kept clean and dry to avoid redness or skin irritation. Larger pads can be placed on the bed if incontinence is a problem at night. Allow the person enough time to use the toilet, even if she does not feel that she is able to go immediately. Limit nighttime fluid intake if the person has difficulty getting up at night. At the same time, it is important to drink enough during the day to prevent dehydration and manage constipation. Use of a laxative may help produce more regular bowel movements. For example, Miralax is recommended by the American Academy of Neurology for treating constipation in PD. Avoid bulk fiber laxatives. These require significant fluid consumption to work properly. Do not forget oral care. An electric toothbrush and toothpaste with fluoride may work best for brushing.
Okay, so we don't need to know how to brush our patients' teeth. We know how to do that, and not much has changed for patients with PD. Just that they'll need our assistance especially, okay? So, what did we learn from the bathroom video here? We learned incontinence is a common problem for people with Parkinson's, and the most common are incontinence, nocturia, which is having to use the bathroom specifically at night, and also constipation. So many people have difficulty with fine finger movements, such as unbuttoning their clothes. So the patients with Parkinson's disease, we want to steer away from putting them in pajamas at night, in which the pants need to be removed with buttons or things like that, or tying strings on their pajama pants in a knot, okay? And that will make sure that if they do have nocturia, or they have the sudden urge to use the bathroom in the middle of the night, that they don't have to fiddle with trying to get their the buttons undone, which will be a very difficult task for them. Also, for patients who do suffer from nocturia, we want to offer them a bedside commode or a urinal at the bed. That way we don't have to worry as much about them trying to walk to the bathroom in the middle of the night when it's dark and they're suffering from PD. This will put them at a higher risk for falls. But if we give them a bedside commode or a urinal, that's something they can use a little bit more unassisted and hopefully help prevent some falls along the way. Now, some helpful tips from the video and myself: make sure that the bathroom is adequately lit and reduce the presence of shadows as you can. So that would mean placing lights along the bottom, preferably at the top. Turn the lights that are up higher on, because then the light will shine down, cause a shadow. The patient may think it's something that it's not, try and step over it, lose their fall, what have you. Grab bars. She talked about grab bars in the video several times. So we want to make sure that if we can get grab bars in the bathroom for our patient, that they have them, and also educate the patient on how to use them properly and where they are. Elevated toilets. These patients have problems with movement. So making sure that the toilets are at a higher level, so it's not so much work for them to come from those really low toilets. And also X marks the spot. We talked about putting the X there so the patients know when to stop, turn, pivot, and they can sit down. And non-slip mats in the bathroom is always a must. Regular toileting schedule can help patients who suffer from incontinence and nocturia. Patients with constipation, we want to closely monitor their fiber and fluid intake. And if regulating their fiber and fluid intake doesn't work, last but not least, one of the most recommended sources to relieve constipation, Miralax. It's something that can be given every day, is not habit forming, and we can mix it with the patient's drink. And that is the end of our presentation. But first, let us review. So the first review question I have for you: when assisting a patient with Parkinson's disease with dressing, you note that the right arm is very stiff in comparison to the left. You should do what next? A, put the right arm in the shirt first. B, put the left arm in the shirt first. Or C, move the arm until stiffness is fully relieved. Or D, none of the above is the correct answer. So I'll give you a minute or two just to reflect, think about what the correct answer is. When assisting a patient with Parkinson's disease with dressing, you note the right arm is very stiff in comparison to the left. You should do what next? What should you do next? If you chose to put the right arm in the shirt first, you are correct. Remember, we talked about this. We talked about if the patient, we talked about encouraging the patient to assist with dressing as much as possible. But patients with Parkinson's disease, their body stiffens. It's a movement disorder, I'm sorry. So if the patient's, you're trying to help the patient put on their shirt and their right arm is stiff, and you want to go ahead and put that right arm through the shirt first, and then you can ask them, hey, can you put your left arm through the shirt? For whatever reason, that right arm has become more stiff after we have got them dressed. Then if you want to, you can ask them to move that arm a little bit more to relieve some of the stiffness, but moving the arm for one session will not fully relieve the stiffness, okay? It has to be a daily thing, continuous, consistent. But the correct answer here is to put the right arm in the shirt first. Okay, next up is our course review. We want to, what we did today, we defined Parkinson's disease, and we were able to discuss the physical and emotional effects Parkinson's disease has on a person. We discussed, and you should be able now to recognize and identify the common symptoms associated with Parkinson's disease onset. So we talked about these symptoms of the onset, right, guys? We talked about the three main symptoms that are present before a doctor issues a diagnosis of Parkinson's disease: tremors, slowed movements, also known as bradykinesia, and stiffness. But some of the other symptoms you may see: dizziness, drooling, trouble with balance, and then some of the psychological symptoms: anxiety, depression, fatigue, sleep disorders, right? Those are the things we talked about. Third, course objective. You should be able now to discuss care considerations for individuals who suffer from Parkinson's disease. We talked about this as well. We talked about several different care strategies for you to care for the patient. We talked about helping them with toileting, helping to prevent falls. We talked about helping them getting dressed. And we also gave you a lot of information on mealtime and swallowing, what to look for to prevent emergencies as far as choking, coughing, making sure that we help sit the patients up properly with pillows, reducing distractions. And we also talked about healthy foods to make sure that the patients don't become dehydrated, because patients with Parkinson's disease are at a risk for dehydration because it is so difficult for them to eat by themselves. It takes a lot of work. Just simple tasks like bringing a spoon to their mouth can be difficult for them. So we talked about that. And of course, the last course objective we talked about was recognizing and discuss emergency safety concerns. So the biggest safety concern that we talked about was falls, and we talked about how to prevent falls, specifically when the patient is going to the bathroom at night. We talked about making sure that we have the lighting at the bottom. Well, first, we want to make sure that the walkway to the bathroom is adequately lit, and making sure that the lighting is at the bottom instead of higher up, shining down, because that can create shadows, and shadows for these patients can become problematic. We also talked about putting an X in front of the toilet or the chair or the sofa, wherever they may sit. And this is going to remind the patient, hey, this is the point where you stop, pivot, turn, and sit. It's going to make sure that they're not sitting too soon, falling, hurting themselves. Also, patients with Parkinson's disease, they may likely be using a wheelchair to get around. So we want to make sure that those patients in a wheelchair, we allow them to roll themselves around in the wheelchair to move freely if they can. But we want to educate them and also take it upon our own responsibility to make sure that we are locking that wheelchair after they finish using it. And then for me, one of the biggest emergency safety concerns is making sure that if a patient has swallowing difficulties that specifically interrupt their ability to take their medication, we are not putting their medication in ice cream or pudding, but instead we are putting their medication inside applesauce and offering it to them. Because if you put the main Parkinson's disease, which was levodopa and carbidopa, now find that slide here just to refresh you guys' memory. Then those medications have an interaction inside the body if taken directly with ice cream, which can affect the way the medication works, okay? So that was a big takeaway from this presentation I want you guys to remember. We have reached the end of our presentation. I want to thank you guys for staying with me for this past hour as we reviewed over our presentation about Parkinson's disease and helping the patients to live beyond the limits of Parkinson's disease. Again, my name is Deontay Marquis. I'm a family nurse practitioner in Southern California. It was my pleasure teaching you all today. I hope to see you back soon. And again, I want to let you know that this presentation is brought to you by ALFtraining.com. I hope you enjoyed it, and I hope to see you again soon. Thank you so much. I'll see you later.